Hip replacement surgery can be life-changing for those dealing with chronic hip pain and hip mobility issues. Physical therapy is crucial in preparing you for hip replacement surgery and can ensure that we will not only help you with the physical aspect, but also the mental aspect. In this video today, I will explain the crucial role physical therapy has in preparing you for your upcoming hip replacement surgery. Hey, my name is Caroline Fott, and I am a licensed physical therapist in Birmingham, Alabama. I help my patients both prepare and recover from hip replacement surgeries. And today in this video, I want to review with you the importance of preoperative physical therapy and the components of preoperative physical therapy. Let's first discuss the importance of physical therapy and how it is crucial in getting you ready for your upcoming hip replacement surgery. Chronic pain could be a primary reason why someone would opt to undergo hip replacement surgery. So physical therapy can help with pain management before going into your upcoming surgery. Physical therapy helps in improving mobility or the flexibility of your muscles and stability, which is the strengthening of the muscles. Physical therapy is not only there physically, but also emotionally. It can help you better mentally prepare for your upcoming hip replacement surgery. Physical therapy can also help in your recovery timeline. So if you're stronger and more flexible before surgery, it will help aid after surgery in your recovery to speed up that process, which can lead into better surgical outcomes. Let's take a closer look at what a comprehensive treatment plan looks like if preparing for your upcoming hip replacement surgery. First, we're going to have an initial evaluation. So with this, we're going to look at different aspects such as mobility, we're going to look at strength, we're going to look at different impairments you might have. And then we're going to look at your goals. This is a big one in physical therapy because we want to match your goals to our goals. We want your goals to be our goals. So with this, we're going to be able to educate the patient really well on how we can get this plan done and how we can achieve the goals for this patient. We are then going to develop a home exercise program specific to your needs and your goals that you initially had, looking at stability, mobility, if there's balance needs for your plan. We have different pain management techniques that we like to use prior to a hip replacement surgery. We use manual techniques, heat and ice, different modalities to help manage your pain leading up to your surgery. We like to educate the patient on what the surgical procedure will entail and what to expect after surgery. We will then continue your physical therapy follow-up appointments to track your progress prior to your hip replacement surgery. In your journey towards your hip replacement surgery, physical therapy is going to prepare you both mentally and physically. It is very beneficial to have a proper exercise program prior to your hip replacement surgery. Click the link in our description below to watch our video, How to Exercise Before Major Joint Surgery. This video details how a preoperative exercise program can help your surgical outcomes.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.